Good morning everyone, Ian Ashworth. Let's wonderfully introduce this. First of all, thank you for coming today. There's lots of things going on in all of our systems. We're hopefully already hearing some of the stories, and what we'll share with you is why it's really important that myself and when Sarah pops up here, we present a unified front and help an end in smoking and know the negative consequences that causes. So just a couple of slides really from us. We're not starting from a standing start. Sarah mentioned a couple of things around the major sector-led improvement workshop that was held a few weeks ago. There's lots of good practice that we are doing in all of our 9 areas around this, including within all of our hospital trusts, where we have a treatment tobacco dependency programme. But clearly we've got a challenge, and you'll see from some of the data why we need to have a good push at that. Councillor Gittins referenced our All Together Fairer strategy. That is our strategy to help and tackle inequalities across the system, and tackling smoking at the very heart of that. You can see the synergy with our vision about All Together Smoke-Free, ending smoking everywhere for everyone, and making sure that we have a tobacco-free future for our children growing up. I've got 2 little ones as well, and I want to give them the very best start in life as well. But we know that there's inequalities, and smoking is at the very heart of those inequalities, which we'll touch on shortly. We've kindly shared some of the key facts at the beginning of why we're here, so I won't repeat some of them, but it's important for us as a system to have those sound bites in our back pocket for when we do get challenged about why this is a priority, or why we are putting action into this, or why we might invest in this. So we know that 2 in 3 smokers will die, and it costs about 10 years on average of life lost. But a good example of inequalities is those with severe mental illness, where that cost of life expectancy increases to 20 years. We know that about a third of cancer deaths are related to smoking, and over nearly 90% of COPD deaths are also related to that. That has massive consequences on how we are treating and the opportunity costs of our NHS services and care services, social care services. So it's really important that the NHS and the local authorities and our wider partners sitting in the room today are joined up on that, and that's what we're hopefully trying to get over through this morning's session. We mentioned the cost, but it's estimated around 2 billion is the cost of smoking for our sub-region. And especially in the time of, and there is still time of cost of living challenges, you can see the cost of that is in some of those households that were addicted to smoking, and we need to support them out of that challenge. We've created a plan, and you're going to hear from other areas today about that framework and how we're going to shape that framework moving forward, so I won't move on to that. But from the NHS perspective, it's really also important to highlight some of the work that Ash have done against what's called the NHS Core 20+5. Some people might not be close to that. It's basically our approach to tackling healthcare inequalities across the NHS, across 5 key clinical areas. You definitely won't be able to see that and squint in, but just to draw an example of that was, think about maternity, CVD, respiratory I just mentioned, and cancer. But in maternity, we still have around 10% of our pregnant smokers. That's nearly 2,250 new births who definitely aren't getting the best start in life that we wanted to have. So how can we support expectant mothers in that environment better and moving forward, really? And then you'll also see that we've got inequalities within that. So even though we've reduced the smoking prevalence by our combined efforts, it's still the same equivalent of the adult population of both St Helens and Knowsley combined together in our patch. It gives you a good idea of what the scale that we've got. So I'm just going to pass over to Sarah now, if that's okay. There we go. My bad.
You did that on purpose. Yes, I'm Sarah McNulty, Director of Public Health at Knowsley. And, you know, we've just covered the impact. The impact of smoking will not be a surprise to anyone. But what you'll hear today, and what we started to hear, is where other areas have really started to combine forces and get a regional approach. And we're really lucky to have had to be learning from some work that's been done by Ash around what nationally, well, I think it's a national report, what regionally we are best working together. So some things are always going to be best doing locally, but some things you get real economies of scale and real impact. from doing things together, and that's why we're here today. So those things are like action on illegal tobacco, in supply and demand, communication campaigns, is, you know, doing that locally might not have those economies of scale. Advocacy, so we've spoken about the bill that's going through, and you know, we've already started some of that advocacy work, and it sounds like we've still got a lot to do as that bill hopefully passes through Parliament. Policy developments and intervention, and then supporting those local systems to develop their own bespoke plans. And Champs have been really embracing the bill and advocacy work, working with our local MPs, really trying to kind of challenge some of those lobbying from the industry, that those messages that they'll be getting, really trying to kind of get above in front of the curve on that, because there will be lobbying, and that lobbying will continue from the industry. The industry does not want this to happen, so we absolutely have to be on the ball there. Marketing and communications work, and I'll talk in the next slide about the work that we've started to do around the wider Cheshire and Merseyside plan. So it was about a month ago, I think, that we had a really well attended, it was over there in the other building, really well attended event. How many folk were there, Andrea, do we reckon? Yeah, it was a full room. Loads of energy in the room. I think I mentioned the word energy about 10 times during that, because I was just overwhelmed with just how much passion was in that room. And we started to think through what the vision would be and what we were best working together. And obviously kind of today is to build on that. So again, there was a real support around that advocacy piece, and continuing that communications, consistent messages, insight work. You know, how can we really tackle those groups that Ian pointed out? You know, that they're not the low-hanging fruit anymore, that we need to support to change. You know, they're inherently much more complicated people with complicated lives, and we really need to kind of understand what's going to support them to stop smoking. And then coordinating activity at that sub-regional level with expertise, and a good sound governance structure. I'll come on to what that framework we might want to include in the next slide. So this is my last slide, and this is very busy, and I do apologise. But some of the things that come from the WHO model that we want to build on, and we want to put into our CNM strategic framework, is around monitoring tobacco use and prevention policies. So building our regional approach to fit into that national vision and those national targets. Looking at ways that we can look at data collection, analysis, and reporting back again. You know, always best on a kind of not at a place level, because it takes a lot of energy to do that. And actually, you know, things like dashboards we're best sharing across, and also it offers that opportunity to compare and see where our target areas might be. Looking at our smoke-free policies and plans, including through the NHS prevention pledges, working with things like our housing providers to see what we can develop those policies that they might want to adopt, see if there's more support mechanisms that we can put into there, and advocate for smoke-free environments. Offer help to quit tobacco use. So that's, again, Ian mentioned those NHS programmes. How are they kind of integrating with our local programmes? Because people don't live in hospital, do they? They need to come out, and we need to support them in their local communities, so that motivation that they've got when they're in hospital, we continue. And we also support their families, because sending somebody back to a household that smokes when they're trying to quit smoking is difficult, isn't it? So there's huge benefits for the wholes. Warn about the dangers of tobacco, so that's around campaigns at scale, targeting messages to that priority population. That's where some of that insight comes in. be proactive, and deliver resources and communication approaches to prevent the uptake. And this is, you know, where the vapes come in as well, around children. So really, you know, trying to think about or trying to work together and understand how we can support as our youth programmes, schools, etc., education, and try and kind of stop recruiting new nicotine addicts. Enforcing regulation, so again, you know, we've spoken about the new powers that will be coming in, and the new money that will be coming in to local systems. So, you know, how can we work together to make that work, and then raise taxes on tobacco. So again, that's kind of a national policy. So it offers us a good framework for our regional work, and then the local places will start to deliver, or will be delivering those local pieces as well, where that aligns. So hopefully we can all work as a system together. I think that's the end. Back to Ruth. Thank you very much.